what about music? Is that positive or negative? Soothing music, does that help?
Probably not a real good idea, simply because noise is stimulating. And if you're listening to music, the brain is active, you're focusing, you're attending to it. It may provide a bit of a distraction, but the best environment for sleep is dark and quiet.
Welcome back to Balanced Health. We're having a great discussion here on sleep disorders with our guest, Dr. Mouton, and we've learned some really important things. And I'd just like you to put people's minds at ease. First of all, if they're having a problem, don't be afraid to discuss with your doctor.
Absolutely.
Or they could just call y'all, right? And
certainly anyone who's having trouble with their sleep should make an appointment and talk to their primary care physician. If necessary, get a referral to a sleep disorder specialist, or people can contact a sleep disorder center directly and see a sleep specialist there.
And what is yours called? What is?
We're the Center for Sleep Medicine.
Center for Sleep
Medicine.
Medicine.
There are centers throughout the country.
Walk us through that a little bit, because I think there's people out there, and I'm not out there, I'm here and I'm thinking it, so probably out there they are. And that's it. Okay, that's weird. I mean, do I wear pajamas? If I come in my SpongeBob pajamas, you're going to tell anybody? If I lay down,
Really confidential. Everything that happens is confidential.
And Joe and I were just saying we would never be able to fall asleep knowing people were watching us.
I come from a background, of anxiety and high-strung people. So, I admit that openly. But, at home, some nights I go to sleep nice, some nights I don't. But I mean, I would just think that, I'd be looking at them, and they're looking at me. Are you looking at me? You looking at me?
Yeah, what
I'm trying to sleep.
Let me start out by saying that not everyone with a sleep disorder needs a sleep study.
Okay.
So very often patients with primary insomnia or, for example, restless legs, there's no need to study them in the laboratory.
Okay.
People are afraid of this, but I can tell you that we don't see instances where patients come in and they're not able to sleep. It simply doesn't happen. Maybe one or two times that I can think of in 10 or 20 years.
Would you knock them on the head with something?
Absolutely not.
Give 'em a sleeping pill.
Actually, most of our patients are usually so sleepy, it's more of a task to keep them awake until it's time to start the study.
They're sleep deprived people.
Absolutely.
Yeah. So they just sleep in this nice environment and they're studied during the night.
Most sleep centers are more like hotel rooms. They're not hospital rooms. In our center, we have full-size beds and private bathrooms with each room. So think of it as an overnight in a hotel room.
We're almost out of time here, but one quick question about sleeping pills. I mean, are they overused? Are they abused? And are they habit forming? We know probably the answer is yes. But yet they're wonderful for for instance, for me, when I'm traveling overseas and I have 8 hours on the plane and I can never sleep on a plane, I have taken a sleeping pill and it's wonderful. But how often is okay? And do you have a word on that?
Sleeping pills are generally indicated for the management of short-term insomnia, something like you mentioned, like traveling or something that's not going to last for months and years. For insomnia that persists more than several months, certainly, they typically are not as effective.
Right.
Some of the side effects can be pretty weird. A friend of mine was taking, I won't mention the name, but he was taking one consistently, and he wound up getting up in the middle of the night and cooking.
Oops,
and the doctor said
dangerous.
that's actually a common symptom. So I started giving it to my wife, and I have cooked meals more often. No, but that's a true story, except for the last part.
That's a very well-known side effect of a very popular sleep drug.
Did you cook?
You have parasomnias. You get up and you do things that you have no memory for in the morning.
Oh my goodness.
And eating is actually one of the more common behaviors.
Well, we're just about out of time. I want to thank you for being with us. Thank you very much. It's been
wonderful.
great.
Thanks, Doc.
Great information. Thanks for being with us, Doctor.
Thank you.
And for more information on sleep disorders, go to tln.com, click on shows, and then on Balanced Health. That's all the time we have. We hope you enjoyed this show. And if you'd like to make a donation or order a DVD copy of the show, just give us a call right now. And to submit your health questions, email us at balancedhealth@tln.com or call the number on your screen, and we'll answer those questions on the air. For Joe Costello and myself, thanks for joining us. We'll see you next time right here on Balanced Health.